It's no secret that as we get older, our bodies need extra care. That's especially the case for millions of people in our country who suffer with arthritis. But there's hope, especially for those who need hip replacements. Midstate Medical Center uses state-of-the-art technology and advanced techniques to help people get back to their active lifestyles. Here to talk to us about the procedure are Dr. Paul Zimmering, an orthopedic surgeon from Midstate Medical Center, and his patient, Janice Baisley, who underwent hip replacement surgery back in 2012. Thank you so much for being here. Doctor, let's start with you. How common are hip problems in Connecticut and America?
Well, in the United States, there are 43 million people who have physician-diagnosed arthritis. It's in various joints. A good deal of that is in the lower extremities, the hips and the knees, to the point where people have undergone total hip replacements about 200,000 times each year in the United States.
Wow, so that's a big problem. It affects a lot of people. Doctor, when would you tell a patient to start considering the procedure?
Most patients come in with fairly classic symptoms of pain, either in the front or the side of their hips. It can radiate down the front of their thighs. Their complaints are usually they have difficulty with stairs, they have difficulty getting out of a chair. One of the classic symptoms is they're unable to lift their leg to put on their shoes and socks.
Yes, I'm actually familiar with that. I'm going to have to go through the procedure myself at some point. Janice, tell me your story. When did you start having pain and you realized this was going to be a problem?
Well, it had started probably a year or two before it really got bad, that I was starting to limp and had difficulty bending down to pick up something or to do the stairs. And it gradually got worse. And then I had gone to the doctor and found out that I had bone on bone, and that was preventing me from doing all of this.
And it's so painful,
it was arthritis,
right?
yes.
It affects almost everything that you do.
Yes.
Doctor, tell me the procedure. How does it, on layman's terms, I suppose, so our viewers at home can understand too?
Probably the easiest way is to use this model that I have here. The problem that we have is that the joint becomes arthritic. All of our joints are covered with cartilage over the bone. There's a cartilage surface on the socket of our hip, and there's a cartilage surface on the ball of our hip. We have a ball and socket joint that allows the leg to move freely. What happens in arthritis is that the cartilage surface wears away. It becomes thinner, it becomes pitted, it eventually wears away. And this is sort of an example of worn away cartilage.
And how does that happen? Is it just over age, over time?
The vast majority of people, it's simply wear and tear. We call it osteoarthritis. There are people who have hip problems either from a trauma to the joint or from a congenital problem, but those are less frequent than the simple wear and tear problem.
Okay.
So the idea of the surgery is to replace the socket and replace the ball. And what we do is, whether you go through an approach in the front of the hip, the side of the hip, or towards the back of the hip, the idea is to take out the arthritic ball, and we cut the bone just below that and remove the arthritic ball.
Okay.
And then we remove the arthritic socket with a special type of instrument that reshapes the socket. So we have...
So you have to replace it with something, though.
We certainly do. And so what we do is we replace the socket with a component that is metal on the outside and has a plastic liner on the inside. There are two pieces. These are molded together, but they're put in separately. And we put that in where the socket used to be. So now we have a smooth surface here. And we need to match that. So what we do is we hollow out the inside of the bone here, and we put in a stem for which the ball can sit on.
Okay.
And using various measurements and various trials, we then will put a ball on the top. The ball is usually metal, can be ceramic or even other materials, and it is sized to fit into the socket, so that now we've restored a ball and socket joint.
You can move your leg again. You can go up the stairs again.
Absolutely, without the ratcheting that people get and without the pain they get.
Let's talk a little bit about the recovery time.
Most people are in the hospital for 3 days. Nowadays we get people up the day of surgery and start them walking.
You get them really?
Absolutely. We do them in the morning. By the afternoon, the physical therapists are in their rooms getting them up a little bit.
That's great. Just let's talk about your experience. You had the procedure done. you had to listen to your physical therapist, I'm assuming.
Of course.
A
And
little
like
bit of work
doctor
along the
said,
way.
they did take us up and out of bed early. And so your therapy started before you even left the hospital.
Okay.
And then you go to a convalescent home or a therapy place and you stay for about a week. And they do your therapy about twice a day.
Let me ask you, what could you do now that you couldn't do before?
Oh, the stairs.
Yeah.
And even reaching up or reaching down to pick something up, you don't have that ratchet feeling in your hip and no pain.
And you could go run a marathon now, right? Doctor, I just want to ask you a little bit about Mid-State Medical and how you kind of separate yourself from the other hospitals.
Well, I think it's the entire gamut of how we take care of the patients. Even before they come in for their surgery, they have an educational time at the hospital where they meet with physical therapists, nurses, social workers, in a class with other people who are undergoing their total joints, so that a lot of their questions and concerns are taken care of even before they come for surgery.
Sure, that's important.
The day they come for surgery, we have a dedicated team of nurses and technicians who take care of them. All the total joints at Mid-State Medical Center are done by board-certified orthopedic surgeons, and they care for you through your entire stay with the assistance of physician's assistants. Through the post-operative course, which is usually 3 days in the hospital, you're in your private room on our orthopedic pavilion, cared for by nurses who have years of experience taking care of our total joint patients.
Sure.
We have physical therapy right on the floor. It's done in your room. It's done there on the floor. We have the physician's assistants who are based on that floor, so they're constantly available. And during your stay, which is typically about 3 days, we have our social workers who are also based on that floor, working with the patients to seamlessly integrate them into their post-hospitalization care.
Very good. So you're kind of taken care of every step of the way.
Unlike Janice's experience, the national trend now is for people to go directly home after their total knees or their total hips. Wow. And we do that with the support of visiting nurses and physical therapists who care for the patients at home. And we found that works very well, both in terms of the patient's emotional status, and they still rehabilitate very well.
Very good. And Janice, what would you tell someone who was kind of pondering the surgery?
Have it done.
Have it done.
Especially if you're in pain. Have it done, don't hesitate, and just follow through with your therapy afterwards.
Very good. All right, let's put some information up on the screen. If you'd like to learn more about Mid-State Medical Center, you could log on to the website, midstatemedical.org, or call 203-235-BONE. Doctor, thanks so much for being here. You really made sense of the whole situation for us, and Janice, thanks for sharing your story.
You're welcome.
Okay.